The accomplishments of the Provincial Health Office of Misamis Oriental from January to May 2024. On leadership and governance, on the subject of the universal healthcare local health system maturity level, which is the pathway to progressively realize the reforms and determine the level of preparedness of the local government unit on local health system integration, Misamis Oriental was awarded as top performing UHC integration site of Northern Mindanao. Based on the mandates of the Department of Health and the Department of Interior and Local Government, all local government units are to submit their respective annual operational plans and local investment plans for health. The Provincial Health Office of Misamis Oriental achieved an outstanding 91.88%, wherein the passing rate is only 85% for annual operational plans. Without the AOPs and LIPH, there will be no Seal of Good Local Governance assessments in every municipality or city. Seal of Good Local Governance is now an institutionalized award, incentive, honor, and recognition-based program which aims to boost the LGU's commitment to continuously progress and improve performance along various governance areas. Multiple activities were also conducted by the Provincial Health Office in compliance to the requirements for SGLG, including rollout orientation, technical assistance, and SGLG validation. Misamis Oriental has been chosen, being one of 25 provinces all over the Philippines, by the World Bank to be a recipient of a massive financial grant of 3.9 billion pesos. Another noteworthy accomplishment of the office is that the 3.9 billion proposed plan was presented to and endorsed by the Regional Development Council Region 10 to the National Economic and Development Authority or NEDA. The Provincial Health Office is in immense gratitude for the relentless support of our remarkable Governor, Honorable Peter Sr. Pedro M. Unabia, for the approval of 5 executive orders and the Sangguniang Panlalawigan in approving 6 ordinances and resolutions. To ensure quality of health services based on the universal health care, health facilities must be accredited in Consulta as well as pass as a primary care facility. The office attended a series of consultation meetings for the primary care providers network. The office also attended the Regional Special Health Fund orientation for universal health care. During the Lab for All project, conducted last May 12 to 14, 2024, which aimed to provide essential services such as laboratory tests, medical consultations, and medications free of charge, the Provincial Health Office was able to provide following services to the corresponding number of recipients. Another major initiative of our beloved Governor was the close collaboration with Northern Mindanao Medical Center in conducting the Hearts Day at the Provincial Capitol grounds last February 16 with the following accomplishments. May 23, 2024. These are the following services and accomplishments during the Press Freedom Week Medical and Dental Mission held at the Provincial Capitol grounds. Public health programs based on the Department of Health guidelines. Under Family Program Cluster, Maternal and Child Health Program. Facilitated Buntis Congress to 5 municipalities, provision of 159 Buntis class kits to different outreach services, conducted assessments for mother and baby friendly health facilities to all public and private clinics and hospitals in the province for accreditation and certification. Family Planning Program. In the Philippines, the demand satisfaction for family planning services among women of reproductive age, the passing rate is 75% based on the National Objectives for Health. However, Misamis Oriental has achieved 89.23% demand satisfaction rate, which means that more are utilizing modern methods of family planning in the province. National Immunization Program. Misamis Oriental ranked top 1 during the recent bivalent oral polio vaccine catch-up routine and supplemental immunization activity from April to May 2024, with SEIR or Synchronized Electronic Immunization Repository upload of 100%, and for flu vaccination, the national target is 95%, but the province reached 113.90%. For the human papillomavirus vaccines for 9 to 14 years old, for the first dose, 3,120 or 60.4%, second dose, 1,532 or 27%. Newborn Screening Program. These are the number of active and inactive newborn screening facilities in the province, both public and private. Through this program, timely assessments are conducted to both private and public hospitals and clinics. Quarterly consultative meetings are also facilitated by the PHO to address issues and challenges raised during the regional program implementation review. Adolescent and Youth Health and Development Program took part in a workshop for the provincial assessment of child-friendly local governance, conducted program orientation to a total of 330 BHWs trained, conducted lectures on adolescent health to 12 secondary schools, attended the CAP Caravan in different secondary schools in the province, attended training on gender-based violence 4Rs, accredited 17 adolescent-friendly health facilities in the province. Under non-communicable diseases programs is the lifestyle-related diseases program. In the provincial capital, a total of 665 employees from 36 different offices actively participated in the hands-only CPR lecture. Dangerous Drug Abuse Prevention and Treatment Program conducted Dangerous Drug Board Orientation Seminar for DDB authorized representatives, which was participated by 11 barangays, attended the first international conference on responsible gambling and gaming addiction held in Metro Manila, conducted validation for Certified Community-Based Drug Rehabilitation Program, or CBDRP, for 4 municipalities. Persons with Disabilities Program assisted in the distribution of 200 eyeglasses to PWD and seniors during the Adopt a Barangay program. Traditional and Alternative Healthcare Program. Misamis Oriental is a national awardee for 2024, deemed by the Philippine Institute of Traditional and Alternative Healthcare, or PTAC, and the office established a vegetable and herbal garden at the back portion of the Provincial Health Office building. For the mental health program, a total of 163 aftercare and follow-ups were done for mentally ill patients and for those with drug-induced psychosis. Cancer Prevention and Control Program. In celebration of the Cancer Awareness Month, the Provincial Health Office conducted 2 lectures in the different municipalities of the province with a total of 120 participants, referred 15 clients to NMMC's Cancer Department and 1 to a private hospital for further management. Under the Communicable Diseases Programs is the National Tuberculosis Prevention and Control Program. The province of Misamis Oriental is a recipient of the Tuberculosis Implementation Framework Agreement, or TIFA USAID project, amounting to $150,000 for a period of 1 year, which has already commenced implementation and renewable if the project is successful. Dengue Prevention and Control Program. Lectures were done on vector-borne diseases, 5S contra dengue methods, together with the distribution of 104 rolls of insecticide-treated screens provided by the Department of Health, which were given to 13 DepEd schools for 309 classrooms. A major initiative of the PHO with the full support of our determined governor, all local chief executives, together with other health service providers, were called upon during the Dengue Forum to find methods to mitigate the expected rise of dengue cases in 2024. Social mobilization activities were also done, as well as fogging of hotspot areas. Rabies Prevention and Control Program. A total of 622 patients have already been catered by the Provincial Health Office Animal Bite and Treatment Center since January to May of this year. Schistosomiasis Control and Elimination Program. Conducted capacity building on integrated microscopy training last May 6 to 10. Schistosomiasis case holding. 7 imported cases were initially treated and followed up. Malaria Filariasis Control and Elimination Program. Conducted the World Malaria Day celebration to accelerate the fight against malaria for a more equitable world, and there is a continuous filariasis case surveillance, investigation, and vector control intervention. HIV/AIDS Prevention and Control Program. Trainings and orientation conducted for 2024 for doctors and nurses, 38 participants, BHWs, 464 participants, pregnant women, 48 participants. Food and Waterborne Disease Prevention and Control Program. Conducted a series of lectures for food and waterborne disease prevention and control to the different barangays of the province. Other programs. Oral Health Program. These are the following services and accomplishments of the PHO Mysore dental team. health promotion. The Department of Health has awarded Misamis Oriental a total of 3.50 million pesos for the pilot implementation of 2 DOH playbooks, and its implementation shall commence within the year. The Department of Health also awarded the province with 5 million pesos for the Healthy Learning Institutions, wherein the Provincial Health Office and the DepEd Misamis Oriental Division are closely working together to improve 10 GDL schools in the province, hence the assessment and pre-validation activities carried out by the PHO Technical Division. Another pilot project of the Department of Health is the Healthy Communities, wherein selected municipalities or cities are chosen to conduct health celebrations. A budget of around 100,000 pesos for food and prizes also from the said agency. In 2024, the Provincial Health Office provided technical assistance to the project recipients, which were Hingoog City in January, Medina in February, Opol and El Salvador City in March. Environmental and Occupational Health Program. 52% or 13 municipalities have been declared as zero open defecation municipalities, 73.8% or 313 barangays declared as zero open defecation barangays. Continuous conduction of food handlers class, poultry and cemetery inspection. Laboratory services facilitated the formulation and revision of manual of procedures, participated by representatives from licensed facilities, performed a total of 57,177 laboratory examinations done by the different government laboratory facilities in Misamis Oriental, and a total of 345 PGMO employees were examined for blood sugar levels. National Voluntary Blood Services Program intensified coordination and program implementation through the following: Barangay Health Workers Program conducted orientation and reorientation of the BHW program to 564 barangay health workers in 6 barangays. First and second quarter consultative meetings were also done. Epidemiology and Surveillance. The Epidemiology and Surveillance Unit of the province facilitated a series of trainings in partnership with the Department of Health in capacitating surveillance officers of the LGUs on epidemic-prone disease case surveillance, event-based surveillance, and online information system training, which also included all private and public hospitals within the province. Constant monitoring of reportable cases is being done by the Epidemiology and Surveillance Unit. Disaster Risk Reduction and Management in Health conducted hands-only CPR to 487 PGMO employees and selected municipalities in the province, conducted multiple trainings and seminars on basic life support and standard first aid. Recording and Reporting System and Field Health Services Information System conducted quarterly monitoring on iClinics and iHomies to all facilities both in RHUs and CHOs as well as the hospitals. The Supply Chain Management Team of the Provincial Health Office, in coordination with DOH Region 10, led the implementation of the Electronic Logistic Management Information System, or ELMIS, go live with 100% functionality of all 23 RHUs and 2 CHOs in the province. For all the different DOH programs, the PHO continuously provides technical assistance to all 23 RHUs and 2 CHOs, which includes collaboration of efforts, supervision, capacity building, filling gaps, and project management, hence the need for close partnership with all 25 LGUs. PHO clinic accomplishments. Since January, 216 PDLs, or persons deprived of liberty, were examined prior to facility transfer. The same team also assisted a total of 1,662 capital employees, and for outpatients, a total of 1,249 patients. Adopt a Barangay program. Quarterly medical, surgical, dental outreach and other services were provided to the community. Adopt a Barangay single-digit poverty incidence. One of the urgent priorities of our noteworthy governor, Honorable Peter Senor Pedro M. Unabia, in carrying out the Paglaom development agenda is his collective initiatives veering towards achieving a single-digit poverty incidence in the province of Misamis Oriental. The Provincial Health Office, through the Technical Division, conducted a survey on 38 households in the adopted barangay of Lourdes, Alobihid. Hospital accomplishments on provision of services. Hospital project accomplishments. assistance to individuals in crisis situation or AICS, and medical assistance to indigent and financially incapacitated patients or MIFIP fund utilization report for the 8 Misamis Oriental provincial hospitals. Comparative PhilHealth claims payment and account receivables.